I've checked the physician's orders for an indwelling urinary catheter, and I've got all of my supplies together. Now I'm gonna go through. Hello, my name's Jordan. I am a registered nursing student with Northwestern State University. Can I get your name and date of birth really quick? Okay, perfect. So your provider has ordered for me to put in a indwelling urinary catheter. That's because your bladder is not emptying all of your urine all the way, so it's gonna help with that. Is that okay? Okay, perfect. All right, and I provided the patient privacy. Did you have any allergies? Any allergies against adhesives, betadine, latex, anything like that? No? Okay, perfect. All right, so I'm gonna start with putting a drape over the patient. This is gonna provide privacy and a little bit of, to keep them warm. Okay. And I am going to place the patient in a dorsal recumbent position. All right. Go ahead and put my gloves on. Okay, and lay down the pad as close to the patient as possible. And pericare has been provided. All right. And so now I'm going to open and maintain the sterile field. I'm going to use this 1-inch border to straighten up my sterile field. I'm going to take out my sterile gloves. And again, just a 1-inch margin all the way around. Now I can touch anything inside the sterile field. Okay, so we'll go ahead and lay this down. It's going to be shiny side down. Okay, so now I'm going to put some of the lubricant in here. And when I pull off this cover, I'm going to pull it off slowly so that it doesn't fall and touch anything outside of the sterile field. So you're going to lube about 3 to 4 inches of that, because that's how much is going to go inside an adult. Okay. And I'm going to attach the sterile water syringe. I'm also going to open up the betadine sticks away from the sterile field. And keep it in there. And now we're ready to insert the catheter. Okay. So I'm going to use my non-dominant hand to keep open the labia. We're going to use the swab sticks to clean closest to me first, around the sterile field, away from me, around the sterile field, and down the middle, around the sterile field. Okay, and going to take your dominant hand and you're going to put in 1 to 2 inches first. Tell the patient that you're about to insert the catheter and bear down like you're needing to use the bathroom. So you'll put in 1 to 2 inches first. Wait till you see the urine coming out, and then go in another 1 to 2 inches. While holding it with your non-dominant hand, you're going to blow up, inflate the balloon with the sterile water with your dominant hand. Okay, the balloon is inflated. So you take that off. Now the sterility part is done. All right, so I will tape the catheter, leaving a little bit of slack to the patient's leg. And you're gonna hang the bag on the side of the bed. Okay, and you're gonna watch the urine and look for its color, consistency, and amount. All right, and you're gonna educate the patient, telling the patient to keep the bag below the waist but not touching the floor. Alright, and so let's take all of this with all your sterile gloves. Wash your hands and put on some clean gloves. You're going to provide pericare again to get off all of the betadine. So pericare is provided. Alright, I'm going to put the patient back in a comfortable position. I'll go ahead and educate the patient on you'll need to increase your fluid intake. Down. Make sure both the side rails are up, and then we'll give the patient the call bell and call if you need anything, and I'll be back in 30 minutes to check on you.